Today, I have the pleasure to talk to Dr. Brian Chang, Deputy Secretary General of the Taiwan Medical Association and Secretary General of the Wonka Asian Pacific Region, the Family Physicians Organization. Dr. Chang, Taiwan has been very successful in containing the COVID-19 outbreak. What did Taiwan do in order to be so successful in limiting the disease?
I'm very honored that you said that you think that Taiwan controlled very well, and I think there are some key factors in Taiwan's control of these pandemics. Based on the lessons we learned from the SARS in 2003, so as early as 2 months ago, the Taiwan Medical Association President Cho has led the officers. Once we know that there are virus outbreak in Wuhan, so we had this meeting with the CDCs in Taiwan, and we talked about the preparation for the personal protective equipment, especially the masks, because we know that from the SARS epidemic, because of the lack of the masks, several the physicians have the contamination in the hospitals. So we think this is the first important thing that we need to prepare. And so that leads to the later on the government take over of the production and distribution of the masks. So because of the well preparation of the protective equipment, the people as well as the doctors will not be panicked about this. So I think this is a very important thing that we prepare early for the equipment. And the second thing is that I think the government trusts the medical expert. So the people are willing to trust the policies the government made, because during the outbreak control, the COVID-19 command center was led by a group of medical experts, and most of the doctors of this group are well-known doctors by the people. So the recent poll of the people, that 80% of them, they are satisfied and they like to trust the government's efforts. So I think the medical professional is that we need to follow, especially when we're facing a outbreak of the pandemic. And the other thing that Taiwan is different from other countries is that we have this national health insurance with nearly 99% of coverage rate. And it delivers that universal health care to all the people around the country. And according to this, I think this is very important, because according to the data from the National Health Insurance, at the very early of the month, people coming from those outbreak regions outside Taiwan, nearly 75% of these people, they visit the primary health care clinics. They do not go straight to the hospitals. And because of these, most of the clinics are walk-in clinics in Taiwan, because of the characteristics of the walk-in clinics, so they can respond faster to these the outbreaks in the communities. So when the doctor in the clinic, they find someone who's have these URI symptoms and signs, they can identify this person and refer them for further testing and for further treatment. And of course, the national health insurance, they have these. They combine the data with the immigrant data, so the doctor could know the patient he faced was whether or not he is a high risk. Because if you're coming from those outbreak areas, he will know that the symptoms accompanying with the travel histories, he can refer for the further testing. So with the division of the patient flow, the big hospitals can can take good care of severe patients.
There's a very high frequency of exchange of people moving between Taiwan and mainland China and vice versa, including the region of Wuhan. What has your country done at the border to contain the outbreak of COVID-19?
We have this quarantine from the airports. Whether you have fever, you have symptoms, UIs, you have screening, you have to take the samples to test for PCR for the virus. So if you are negative from the test results, you go back to your home. You have home-based isolation, and you have to wear a mask. You have to clean your hands, avoid going to the crowded places. But you have tested positive, or you are the contact person to the confirmed cases, that you are mandated for the isolation to the place the government decide, or to your home place, following some rules that you need to avoid having meals with your families. You have to have the social distance around like 1 meter to 2 meters, and there will be someone from the from the government. They will call you to ask how you're doing well. If you have symptoms like cough, fever, or rhinorrhea, they will transport you to the designated hospitals for further testing.
Are those special hospitals that take care of the COVID-19 patients?
The government has announced 160 sort of these hospitals. They are responsible for the testing and for the suspected cases.
During the SARS outbreak in 2003, Taiwan suffered quite a lot, and you were complaining about getting no help from WHO. Has that been improved now?
As far as I know, I did not get the sort of information from the WHO or the government. But I think that people in Taiwan are willing to become a member of WHO. That's because we want to share our experiences with the world.
With the remaining cases, how do you foresee to proceed in Taiwan?
We have to reinforce the primary health care roles, that we give them the reinforce of the protective measures, protective devices. We give them a reasonable reimbursement, and we give them the proper training, that maybe a portion of the primary care clinics, they can dealing with the fever, the rhinorrhea, the URI symptoms patients, while the rest of the clinics can do the usual daily normal medical deliveries, such as the chronic care control and with some medical treatment, or with other organ systems diseases. So we have to trying to build everything back to normal. We spare some of the portion to taking care of the COVID-19, while the rest of the capacity we treat the daily the emergency or the chronic cases we have to deal with the medical conditions.
Dr. Chang, thank you very much for this interview, and all the best for Taiwan.
Yeah, you too. Here. Bye-bye.